Hello, everyone, and thank you for joining me today. My name is Suness Hall. I am a research evaluation assistant at the Upper Midwest Agriculture Safety and Health Center. I am also a Master's of Public Health candidate at the University of Minnesota. Today, I will be discussing the contextual factors in ag health and safety, as we heard from experts at UMASH through an internal needs assessment that has been going on for the last year or so. During this needs assessment, we had one-on-one interviews with our interdisciplinary team at UMASH, which is made up of researchers, staff, and advisory board members. And these people have diverse public health, veterinary, agriculture, and occupational health and safety expertise. So the few contextual factors that I get to share about today will be coming from this data, and will also be accompanied by national data and research from the last few years. The first contextual factor I'd like to talk about is the shifting agricultural landscape. We have seen fewer family farms and more large operations, especially in the upper Midwest. According to the Census of Agriculture, between 2012 and 2017, the number of farms has decreased almost 8%, but the average farm size has grown by 8%. What this means is that operations need more employees and more workers are subject to OSHA regulations. Also, less families are involved in farming, and it's more and more difficult for family farms to be competitive with these larger operations. Simultaneously, what we've seen is a resurgence of local food movements with smaller operations, and oftentimes they use sustainable or agroecological practices. And a lot of times too, these operations are ran by newer farmers, and they're involved in these operations, but they might have less experience in identifying risks in their farming practices. They also may not know how to effectively reduce the risks on their farm. And this is definitely a place where occupational health and safety could intervene in these kinds of operations. Next trend is migrants and immigrant populations in agriculture. The makeup of the ag labor force in the upper Midwest is increasingly an immigrant workforce. And research from the last few years shows that the majority of hired dairy workers are non-US born immigrants, and migrant farm workers are typically excluded from worker protection regulations and policy decisions. And many experience unique social and structural challenges to health and safety. These unique barriers that they face require a culturally specific outreach, research, and legislation approach that's guided by occupational health and safety experts. Additionally, migrant farm workers and their families have more negative physical and mental health and safety outcomes. And again, this for occupational health and safety, this means that strategies need to adapt and better reach these populations through culturally specific and responsive approaches that promote equity and justice. And we saw some of these issues and specific barriers in health and safety during the pandemic, with things like crowded living conditions, crowded working conditions. These barriers to health and safety are ongoing. Finally, a couple notable contextual factors that I don't have time to fully get into today. Of course, COVID-19, farm workers were publicly highlighted as essential workers. And for this could mean that their profile could be raised, especially profile of ag health and safety. And maybe we'll have more funding for policy or interventions to support the health and safety of food production workers. Again, this would affect immigrant and migrant workers potentially. Additionally, climate change continues to be an issue. And we have also already begun to see the limitations that this creates in health and safety food production, and the need to adapt in agricultural practice, as well as new occupational risks from extreme temperatures like heat stress or cold stress. Finally, surveillance is lacking in ag health and safety. I heard this a lot from our experts, and this prevents our work in terms of justifying it or completely understanding the extent of the work, and it makes research particularly difficult. In conclusion, I just want to acknowledge that there are so many more contextual factors at play in ag health and safety, and these are by no means the most important ones that I've talked about today. As is the nature of context, it always just depends. The factors that I discussed today are changing the makeup of our agricultural workforce and their corresponding risks in health and safety. So I hope that you keep some of these factors in mind as you pursue your own way of promoting and protecting the well-being of ag producers, workers, their families, and their communities. Thank you for listening, and I will be happy to take any questions after the presentations.